they will come up, how they will present. Sometimes we remember, so when we talk about rainbow, the colors, in view of our Raj view. So one of the teachers told that I'm having a boyfriend named Raj view, and we are going to meet tomorrow, and we are going to introduce like that. Creating some enthusiasm in the students. So this is one technique. We are introducing one topic, with some examples like that, creating some interest in the students. So here the topic itself is writing a lesson plan. So we will be doing so many preparations before we do something. Suppose we are going for a tour. So we will be doing so many preparations like packing of materials, and then booking tickets, booking orders, like that. As we do so many preparations for a tour and all, we can succeed. Here also, to become a very good teacher, to achieve our goals, we will also prepare one plan. So that is a lesson plan, how we are going to execute in the classroom before the students to make it so much fruitful for them to get masterized into the subject. Okay? So writing a lesson plan. So today's session objectives are to develop a lesson plan appropriate to the objectives and teaching learning methods. What is the need of writing a lesson plan? So to teach or to impart an effective lesson, we should have a good plan, as it would help in completing their teaching learning activity within specific periods for completion of all learning goals. What do you mean by lesson? A lesson is a structured period of time where learning is intended to occur. It involves one or more students. An insight gained by learner into previously unfamiliar subject matter. So what is a plan? For a house to be constructed also we have some plan here, as you can see here. So we can see a plan over here, and then finally the execution of the complete house, how beautiful it is. So here we are going to do this plan like this, and we can see the success of the evaluation of the student. Okay. It is a detailed design for doing or achieving something. So next, coming to a lesson plan. A lesson plan is a document or instructor's design or roadmap of what students need to learn and how it will be done effectively during the class. And if you see, there are 6 steps and 8 components in the formulation of a lesson plan. So the lesson plan should include the instructional design or learning objectives. So it is a written guide to achieve learning outcomes. It is an integral part of the planned teaching and learning activity, and it is an essential tool to direct and achieve the goal of teaching. So a medical teacher makes himself or herself more organized to attain the highest level of learning outcomes. As per Oxford Languages, a lesson plan means a teacher's plan for teaching an individual lesson. So before the beginning of any activity, the plan should be kept in mind, as it would help in the proper and smooth functioning of the activity. So before we come on to the stage, we come up with some ideas how we are going to present. So that has to be kept in mind. And for teaching purposes, before starting any class, the teacher should keep the plan for teaching in his or her mind or any physical medium, preferably in a physical medium. So we can see we are using some software sources and also some hard copies like this. So we can keep some lesson plan for execution of the lesson plan. So it is an instructional design for a lesson plan. It's a key element to the acquisition of knowledge and skills more effectively and efficiently. So sometimes we can see some maneuvers like suprapubic aspiration, like that. So many things will be there. So we can put some examples. We can present in the form of some audio things, audio visual aids. Then so we can make it more effective. So what is the importance of the lesson plan? A lesson plan helps both the teachers and the students in multiple ways. It will help the teachers in meeting their educational goals, especially when obvious Educational objectives are not clear. Previously, sometimes if anybody will ask, go and teach about mind body function, then go and teach about mind body function. Like that. So we are not going to prepare essay election like that. Some people they can do like that, but some people directly they go into the topic. So we can create some set induction. Next topics we are going to see how you have introduced about the topic, how you have discussed about the anatomy and physiology, and then pathology and after the disease proper, then how you are going to manage that. And in that scenario, we have to plan. So it helps in providing a historical record of educational activity for validation of inclusion topics in question. A lesson plan can also help in formulating a new class of the same topic. It also helps in communication among teachers of any topic so that in the absence of a pre-designated teacher, any other teacher can take the class. Actually, here when we are forming some teaching schedules, when we put the topic, we put according to the one of the top comprehensively given to one faculty. But I have observed in the series value, whenever the topic is allotted, every time it will not be one faculty, but two faculty will be there. So two people will be attended the period. Suppose unexpectedly one of the teacher may fail to attend the class, but the student should not affect their learning process. So the other teacher will come up and they will take. So it will become easy when there is a lesson plan. So already it has been formulated. Further, we can also knowing this, we can select one system like all the faculty in the department. They can choose some topics and they can prepare the lesson plans. So it may take a long time for the beginning, but in 1 year we can complete all those things. Software will become easy. If any, even though we move, transfer from one college to other college, but the material will be there in the department, and it will help all the faculty in bringing the learning outcomes in a successful manner, and we can become very good teachers, and also we can produce very good students. So what is the purpose of the lesson plan? So it helps us to think in detail how to approach a teaching and what is the most effective way to help students to learn. And we can organize the content and also the time and what are the strategies to present. And we can also assess the students in learning. Suppose if you are going to teach one lesson, how far they can understand your topic. So at the end of the lesson, if you ask some questions, then you reproduce with some answers, and it gives some confidence and it will help a lot. So when you use up our in terms and we also feel very happy that the students have understood about the topic. And what are the characteristics of a good lesson plan? So based upon the previous knowledge, and we can assess the students what level of knowledge they are having before we are going to an interview topic. What are the basics they are having? And it should be at the level of the students. So we will be knowing so much knowledge, but it should not be like projecting of bombarding with the knowledge. But we have to make the students to read, we should be teaching to the students as the topic can be understandable to the students. So that's how we can have to plan and we can produce some strategies. We can think various things. Some people may use the chart and blackboard. Some people they use PowerPoint. Some people they use audio things. And so we can also engage the students in doing or practicing some maneuvers, especially practicals. We can ask how to measure blood pressure. Suppose we will be demonstrating and asking the students to demonstrate that. So such that we can, at the same time also we can increase the interest among the group activity among the students. So we have to assess the students, how they mentality is there, how their minds is there, how to make the student to get interested in the subject. Right? So we can use the motivational techniques. So it also includes some necessary materials for that, like as I was studying about material, and it should be interactive. Did you have noticed how are you, how the previous sessions like that? So that interaction should be there. Most of the time, some of the teachers they used to present all the topic, whether in the PowerPoint presentation or orally like that. Some people they won't interact at all. So we have to get interaction with the students. Then only it will be very much effective and the students will also remember the topic in a nice manner. Communication helps a lot in learning. And it has a proportionate time allocation. We cannot take too much time. Sometimes when it is 9 to 10 class and 10 o'clock the class is and then suppose if I belong to so let's say I extend the topic is up to 10:20, is it okay? It's not okay. It's going to affect the teaching schedule. So we have to prescribe means we have to put the strategy and we have to complete the prescribed time schedule. But that also we have to divide the time of 60 days. How we have to divide. Okay? That also I will show some examples. So it includes the evaluation process. That is a study at the end of the class we are going to ask the students a question. So we can ask the questions like so we can ask directly like oral questions we can ask. We can give some Google Forms link to them. Sometimes nowadays previously a teacher asked me while your mobile is inside like that. Now it is not like that. The students' activities also not like that. So they cannot sit or stand or anything without mobile. So everybody is like that only, even we also like that only. So the thing is we have to create interest. So we can make it interactive by using some digital tools like that. Like Kahoot and Socrative, Wall ED, and then Slido.com. Like there's so many sites on it. So in fact also we can ask the students to open their mobile to open the site like Slido.com and post a question in that. And the students will bombard with answers. So they will project on the screen and you can see the answers directly here. How variable are the answers, how they are simple the answers, how much well was about the topic which was taught in the class. See, some people, if we ask a question in the class, so many people will be like introverts, so many means they cannot come up with the answer. Though they know the answer, they feel very much shy to stand up, to give the answer, and they give the answers in a very low voice. They want me to be confident, even though they know it is not. So some problems will be there. Such things can be overcome by using these digital tools. So what are the requirements for formulating a lesson plan? So for making a lesson plan, following things should be kept in mind. So we need students first of all. Yes or no? So it is essential to know the baseline knowledge of the students, what they want to learn, and the extent of their actual interest in learning. Suppose if we start the lesson, we can see the mindset of the students. If they are very much keen, interested, and looking at us. So they are eager. There is no need to induce them. Some of the people are not concentrated in the way working and talking like this. Some people sit in the class like this only. Their spine will not be in normal anatomical position. So usually what I will do means obtaining the attendance, I'll ask other students to stand up. And then sit erect, look at me, hear to me, listen to me. Like that I'll ask them, give instructions to make them put their concentration towards the class. And we'll ask them and create a narrative one story such that it will create some interest about transition to the I'm going to tell them a love story about the dogs of all plants. So all the sensations can. So in a nice manner, if you take into that, people, the students will involve into that. So some techniques, and we have to know the level of interest. So we can ask some questions about the previous session. Sometimes we'll be taking a topic continuously like a partner and partner like that. We can ask the questions how far they have gained the knowledge of the previous class, who have been taken by some other faculty. But we can use some of the things summarize the previous topic and then go into the present topic such that they can have a continuity of the topic which they are going to teach. And what are the strategies? For the teacher, there should be specific strategies predetermined for teaching students, as we will see. So requirements for formulating a lesson plan. So grouping. Teachers should know the group behavior of students, so the group behavior can be utilized properly. For the classification of learning, as I was telling you, we can see the group activity also. Sometimes the students from the front rows are very much interested. And by seeing the students also, the other students will also put some interest as they're doing, they are answering better than me, answer like that, it will create some interest in the passive students also. So that the group activity have to induce in the students. It's coming to the timing it should be predetermined what would be the limit time in which the teaching would be finished. So furthermore, it will be important to choose the perfect timing within 24 hours a day for the teaching of the particular subject. Suppose we will be having the schedules from 8 o'clock to 4 o'clock, and we are having to prescribe above that. And depending on that, you have to plan. How to plan about the steps and the components and describe in detail. So there will be some repetitions also that will assist you at various levels. That's one. So all the materials and methods that are going to be used should be prepared and rehearsed before the teaching activity. Suppose any time when we are going for any presentation of any dance program like that, suppose we are going to execute an action. Like that. So before doing that, I'll be doing so much of practice inside my home. And then only I will also explain the action before a mirror, how I do like this, how I do this and that, and what will be steps like that. So that is quite common when we see. So like that also, so we have to prepare for the class. So behind the screen, before coming to this stage, we have to give a practice. So that will help in the execution of the teaching activity in a public. What is the success of learning must be evaluated through an assessment-based approach from the students, such that it can help in the improvement of teaching ability of the student. So like I said, assessing it will help a lot. Suppose the students they are unable to answer the question. Suppose they can ask the questions maybe regarding the knowledge. Sometimes they may not answer the questions which are like using application, which are using like instead of analysis. So then we can understand the level of the students. How is their level of means knowledge? Then we can plan some strategies such that we can ask the students, make the students apply the knowledge and analysis level and also the application level. Suppose if you are giving some knowledge about the treatment of hypertension. So, suppose we are using some medication in some conditions, there is some contraindications. When he comes to practice, how he is going to implement. So, suppose the patient is having chronic asthma, and we cannot use the beta blockers. So, we will be using, suppose relatives of heart rate, we can use beta blockers. But in case of chronic asthma patient, we may not prefer them. So, that should be the application. So, like that, we have to apply the knowledge. We can make the student that level. So, that is the main goal of our teaching. And there should be a specific sequence of every event and any teaching episode so that there is more transition of knowledge with further improvement. It should not go like step like it should not go in like get ready as we will be doing in physiology the test it should not be like that, but it should go in a smooth fashion. It should be a continuous sequence you should be there. And before starting or making a lesson plan, it should be kept in mind that why is the topic or subject is important, and this important should be told to the students. Suppose there may be, I'm going to teach about the upper motor neuron or corticospinal tracts today. What is the importance of it? I'll be telling about the anatomy and about the physiology and how the tracts are going and what happens when there is any transaction or any lesion, how it is going to present like that. So we have to tell why it is important. So we can be seeing some patients with upper motor elongation and lower motor elongation, and how we are going to differentiate human region from an elongation, like or sensory taxon, cellular taxon. Like that, we have to tell about these things. So such that when they become doctors, they will remember this example at the level of first year of phase 1 and MBA students only. They will be knowing, but when they are into phase 3, then they will be seeing the cases and they will apply the knowledge to them. And lesson plan is learning expectation from the students, and then what materials teacher will use for the class, and how teacher will check understanding of the student. So these are the requirements for making an effective lesson plan. Then here, as I was telling, the components of the lesson plan. So there are 8 main components in the lesson plan. The predefined objective learning activity will be SMART criteria. What is SMART criteria? It should be specific, and it should be measurable, attainable, relevant, and time-bound. One anticipatory setup of set intention for attracting the minds of the students towards the learning activity. As I was telling about the introduction, it is called set induction in the medical education. So we'll be knowing so many things, but the thing is, they have formulated all these things in a different terminology of medical education. So it's called set induction and direct instruction for delivery of the content and the predetermined strategies for the students to practice what they would learn. And properly closure of the class with a brief discussion about the topic in small groups and independent practice of the students and in the form of homework to practice the learning. Depending upon the topic, maybe a daily topic, practical topic, or small group discussions, like proper materials and methods for content delivery, and formative and summative assessment for checking to if learning objectives are met or not. So we can think whether we can, after conducting the assessments, we can assess the students whether they have met the criteria or not. So this is one more like a step pattern. So these are 6 steps how to prepare a lesson plan. So already have given some examples and discussed, and here are the steps. So set intention is an essential element of the lesson plan. The gaining of attention of students is one of the most important steps in educational session. The attention of the students is needed to capture the stimulus, the best ways to present the real life scenario. So we can induce students as far as set intention. The next, formulating a specific learning objectives. So specific learning objectives. So here you have to remember these steps. If you want to make it note, you can make it note. If you want any attachment also, I'll send you a group. And here, after completing this topic of my presentation, you have to do an activity. Because I need to assess how far you have learned about writing a lesson plan. That means you will be given some volumes here of the competencies available, whichever competency you want to select it. And then you have to write the step induction. That means phase 1 students, phase 2 students, like that, that's what you're going to do. And then you have to write the specific learning objectives of that competency, which is chosen right. So here are the HR words and you have to write. So please concentrate. So these are the things you need to mention. So set induction, and then whoever presents well, they will have a nice hint also. Okay. So specific learning objectives will help in deciding at the end of the class what the student will be able to learn or perform. And they should be in concordance with the competency to be acquired. The learning outcomes will help the students motivate them essentially if they are able to complete the lesson. For the purpose, the teacher must know about the topic of the lesson. What the teacher wants to impart in the minds of the student during the class, and what the teacher expects the student to take home in their mind from the class to understand. So these learning objectives should be prioritized. It is the pillar of any lesson plan. So specific learning objectives are very, very important. So even if the topic is given to you, try to make it a habit of preparing a lesson plan from now onwards. So anytime any topic is given, then we will study and we will be telling everything. The thing is, we are not keeping it in a proper manner, which is more important. Like we have to introduce the things also to the student, such that they know where to give importance. How like this. This learning objective should also be addressed. Okay, the domains of learning can be divided into psychomotor, cognitive, and affective domains, as I was telling. So for any topic, the specific learning objectives can be made by some things, see the do, the action verb can be. Then the thing to be done, what they have to do, and how the adverb of your action. For the topic of hypertension, the specific learning objective can be measure, that is called to blood pressure of the patients, and and what are the thoughts, how we have to do. These things we have to assess. Suppose if I have taught the lesson in the practical session, I'm going to introduce about the blood pressure, what is normal theory they have learned. I'm going to measure the blood pressure. How we have to use the BK apparatus, whether phase 1 and phase 2, how we have to use it. So we should know all the parts of the BK apparatus first of all. And then diagram 2 inches above the cubital fossa, especially the left arm, and have to mention where they are going to measure, whether it may be now or the lower limbs also. But here we are going to be using the left arm. If there is any difference between the right arm and left arm, also we can mention. And also we have to do the first of all, there are three methods you can see. Oscillatory method is there, palpatory method is there, and oscillatory method is there. So by what method you are going to measure? So you know the types of methods and also by which method, how it is and how variable it is, why that difference is there, and also we should know some application of that, like what do you call it? This oscillatory gap. Usually they will not come across when they are doing it at first year in phase 1 and phase 2 because they are examining the normal scripts. But when they come into practice, they come up with that situation. So they should not miss it and we have to emphasize such things and apply that knowledge when they are into the practice. Okay. So here we are discussing getting objectives. Saying smart getting or smart getting. Tell me now. S for what? Specific, measurable, attainable, relevant, and valuable. So, the introduction of the topic should be attractive to students. So, we can make some attractive PowerPoint slides and we can narrate also. So, these are all the skills of a teacher. We have to plan ourselves, we can design ourselves. We can get these skills from our teachers or from our colleagues. Sometimes, so what I was doing is SR in government college. We used to attend, even from professor to all SRs. We used to attend all the classes for this college. We will sit in the back of the students, and the students will also have these teachers are there, and they will listen to the classes. They will not listen anymore. Means gets already institution like of time like writing reports like that. We have noticed some students like that also. And when they are presenting, from each teacher we will learn some new things, maybe a junior or senior. So it will help a lot. So even in Kadapa College where I was doing my PG, our associate professor Dr. Veeramohan. So though we have PGs, we used to ask permission, can we attend your class? So, sir, we will come, sir, like we used to do. Sir used to attend the classes. He will maintain a diary, small diary, for each and every student or PG student like that. And we write what are all the positives and what are all the negatives. And if the PG is interested, then we will open up and we will tell what are all the positives and what are all the negatives. Even in PG training also, it will help as our faculty, we can find our PGs also how to do this thing. And how the negatives can be handled. So senior colleagues will help us a lot. So we can also allow our colleagues to listen to our classes and help us. So we cannot feel that they are criticizing us, but it will, any criticism will help in evolution. So we can become much better when we go to some other stage. So because of the criticism, we are all well developed. So for introducing any subject, a teacher can incorporate any personal experience with it to make the topic more relevant. So we have to plan to check if the students understand or not. Same thing. So assessment or evaluation of the students understanding the given topic is of utmost importance. This is our goal. So this has to be planned to ensure that the learning outcomes are met after the lesson. The teacher should plan the questions in the form of MCQs or oral questions or quizzes or activity demonstrations regarding the understanding of the topic. So there are regarding the activity demonstrations. When I went to the Medical College, there one of our senior faculty, after teaching a practical demonstration, she asked a group of students to come onto the stage and perform the act. So that thing here we will not use here. So the thing is, they will be going to separate rooms and they will be doing, but they will be doing on the stage, boys and girls. So that will help a lot how they are going to answer when they come to practical presentations. These people found the difference that who are practicing, they are executing well in the practicals. And there are various platforms we can work up with this. You can make a note, Kahoot, Socrative, etc. that can be utilized for that. You can also note slido.com and call.polyleader. And finally, we have to summarize. So after seeing a nice movie, Mangalu, what happened? Finally, Bhavya, what happened in Mangalu? So, he married to Sonali. So like that, we have to summarize the topic here. So there should be a summary of the whole class and then has to be key points of the topic. So we'll emphasize depending on the importance. And this take-home message should be brief and specific so that it will create an impact in the memory lane of the students. This timeline, there should be one time constraint framework for all activities of specific learning objectives. You recognize that as the attention span is not, it's limited, so we can put maximum up to. Here it is 15 minutes, altogether we can engage the student continuously for 45 minutes, not more than that. So we have to give a 15 minutes break. So always I design a class for 45 minutes only, and the rest of the time for rest, and also for the attendance. So don't plan the critical 60 minutes like that. All the teaching activities should be divided equitably in the provided total period. The starting and closing of any teaching session, the important part. So it will be very nice. As we see in a movie, how he will introduce the hero and how he will end up in sitcom. So like that, we can also create a lesson plan in a creative manner to make it interesting to the students. So conceptual framework of the lesson plan. So the lessons may be, letters may be little small. I will share this copy to you. This is taken from a journal. So lesson plan for modern contraceptives. So it is a practical session. Template for steps in the lesson planning for teaching modern contraceptives. See here the title of the topic. So you can see this is the group of the students or the various students, and the number of students is mentioned. And what they aim is to enlighten the students with knowledge of the modern contraceptives. What are the specific learning objectives here? To learn about the importance of contraception in family planning and explain the various methods of contraception. And Gabby's 9 units of instruction model will be used for delivering the content of the lecture, that is attention getting like that. So regarding the objectives and recall the previous subject like that. Okay. And you can see here the time, the 5 minutes for stating and explaining the lesson topic. So we can use what teaching method you are using. You can have a screenshot of this if you want, such that it will help you. Now you may be planning some topic, how you are going to prepare your lesson plan, how much time you are going to allot, and what teaching learning method you are going to implement, and what are the teaching aids you are using. So 15 minutes for ascertaining the students about the existing knowledge, and actually this is not a 1 hour class, but it is about a topic. About a topic. So 60 minutes for explaining the core content, and then 30 minutes for the teaching the skill of insertion of IUCD, and then 15 minutes for recapitulation, respond to any question, and then testing each student, that is the evaluation session, and then the take-home session, and we can also take the feedback. How many are there enough to take the feedback? It is not there enough nowadays, but it's a must. We have to take the feedback from the students. It will help us to improve. And also, what are the do's and don'ts, and how the students are reacting. Like that, we will be taking the feedback. Even for this session, also, for all the 3 days, day 1, day 2, day 3, you are having some feedback forms. Yes, or no? So, for this session, just like that, also for other topics, you can decide one feedback form. And this is a student-centered learning and behavioral positive influence by lesson plan. So the medical educator plays an immense role in enhancing the understanding of a particular topic. So some of the slides were taken from the NMC also. This is one thing from the NMC. So the input and output, process and then output. So this is all the thing. Just I am putting, you know all the things already I have summarized. Okay. So we can go through. So input means all the learners, the teacher. And the process is actually delivering of the lesson. And then steps for planning a lesson. So we can take an example of the topic hemodynamic disturbance. Already we have seen hypertension, then IUCs, water compensates, then edema. So we can quote some example like this. We can have seen anyone with this like this, why this is like this, why this is like this. We can create some interest in the students. So what is the input means? This is the second year MBBS. So only the thing is terminology is little different. Input we are using like this. Lecture, video, animation, you can draw it in the form of a diagram or discussion, then quizzes, group discussion, and problem-based learning like that. This is set introduction, and then discussing about the objectives like that. You can see for anything which I have to write at the end of the session, the student, the based on MBBS student should be able to. Like that, we can write and then write the specific learning objectives. They can be able to the thing which we have to do now. Define and classify edema, like describe the age of pathogens of each type of edema, morphology of edema, effects of edema, like that. And then about the activity, how they are executing the lesson. Okay, so the same steps only. The time allotted is 25 minutes. Then we have to summarize the topic, and then we have to interact with the students during the interaction. So we can ask the students, are you having any doubts about the topic? They can come up with some questions, so we can answer. It's like interaction. And then we have to assess the students. And we have to tell about what we are going to teach for the next topic, such that we can technician the student such that they can come prepared for the next class. So then we can take a group activity like this. So you will be having group activity. So this is a general form of the same thing, input, introduction, and the objectives like this. So this one more thing. Only thing is here is one thing how to write the like different terminology. ABCDs. The same thing only audience, behavior, condition, and repeat. It's called ABCDs of lesson planning. This is one more thing called as VPM model for lesson planning. That's the same thing only. Thing is warm up, introduction, presentation, practice, evaluation, application. Same. So warm up, then introduction, then presentation, then practice, then evaluation, then application, and then this is for the planning week of the warm up, VPM model, introduction, then presentation, practice, evaluation, and also the application. So nowadays in pathology or in physiology, the questions are not like straightforward. Write about physiological anatomy of the cardiac circulation and describe about the mitochondria. Means they are quoting some example like it's not like that. But then we need a scenario like this: 65 years age male came up with a OPD, presentation of sweating and vomitings, and pain the left hand on the chest region. Like that, we can describe the scenario. Then last, what is the diagnosis? What might be the treatment, like that. So they are going to do this. So application is very, very important. So this is also one model for the 2 minutes class time in the topic surgery and supermatic bladder aspiration. Like this, we can plan course of method, media, duration, evaluation forms. And this is for the suggested readings. You can take some what if you want. These are the books. And these are some references, online references. This is support from NMC. So thank you for your patient listening. So the thing is, now we're coming to a group activity. Are you okay? Are you ready? So you can, I request Dr. Amini ma'am to help me in this activity. And here there are 1, 2, 3, 4, 5 groups of it. So the thing is, you have to take your UGC curricular volumes, which curricular volumes. Whichever competency you like, you select that one and come on to the flip chart board. So one has to come up and present. Okay. So at the end of the session, you have to prepare the specific learning objectives. You have to write a lesson plan. You can prepare for lesson plan. Like you can select. So you can take your curricular volumes, select one competency which you like. The time allotted for you is 10 minutes. In 10 minutes, you have to go to your picture boards and then you have to write the competency number. At the end of the session, the phase 1 or the previous student should be able to, like that, you have to write. What are the specific learning objectives in that topic? So we have to take the objectives. As you have seen the training course, how we have written vocabulary, how to define animal and classify animal, types of animal. So it is a feedback. So all of you need to discuss among yourselves. And we want stand up and write. And then one has to present. So here we can also allot the, and if you want it slide, slide. So please mention the specific learning objectives. There is a core topic, there is a content. So first of all, please take 45 minutes of time. Because we will be designing for the mandala like that, you take 45 minutes of time. So write the time for the self-introduction and then what is the time allotment for self-introduction? Of your choice. Time is of your choice. But the thing is, how you are dividing the time. Please mention. What is the time for stating and explaining objectives and mention? And then formulating specific learning objectives. Specific learning objectives should be clear. Mention the time and also teaching learning method, materials you are using, and also assessment. If you need any help, we are here for you. Now when you are here, you can raise your hand. You can do it directly with just save the time constraint. So time can be divided only, but the thing is, please concentrate on the specific learning objectives, what is the teaching method and aids you are using, and assessment methods you are using. These courses are ready. Time allotment, then next time. Need to pay for the hybrid side. It will be a hybrid side. Please, so all of you please be seated except the present team. So this is the first group. Okay. Okay, all the participants, please be ready. So the first group, what is your group, ma'am? Group one, please.
The last time, madam, we don't need it. I think we will come to it.
Never late, never late. We can do it in the last moment also. Okay, we think ours is like red book of red roses and then. So who is going to present now? So all of you please.
Topic is information for grade 12 million students, a total number of 175 students, and the teaching learning method is lecture. The competency is PA 4.3. It is defined and described product information, including causes, facts, and enumerate with examples of non-specific and mathematics information. Our specific learning objectives are at the end of the session, the student should be able to define and describe product information, the causes of product information, types with examples of non-specific and mathematics information. Our lesson plan duration is 60 minutes. It is divided into various categories. For introduction, by lecture with a PPT for 5 minutes. Next, ascertaining student knowledge with a question and answers using PPT for 10 minutes. Then defining and describing the drawing information through lecture by PPT 5 minutes. Causes of information by lecture with PPT for 10 minutes. The types of examples of information, various types of information by lecture using PPT for 10 minutes. Summarizing with a take-home message 5 minutes. Assessment 5 minutes by using question and answers. Feedback using slider for 5 minutes. And lastly, for attendance 10 minutes. So 5 minutes.
So, all of you please be attentive and listen. So here, the competency, and she has presented very nice. So mention the competency and then the notes. So some small corrections are there. We can do the introduction like, okay, you're going to tell about the topic form of PPT, or we can use some questions like that orally also. And the thing is, ascertain student knowledge, asking questions. So we cannot ask the questions. Sometimes we can ask by posting a PPT. Here also we can use the slider.com like this. We can use the ascertain, and we can ask Google Forms. So we can use the hard copies. And one more thing is feedback. We cannot take slider.com. Feedback. We need some Google Forms, or we can use some hard copies, and we cannot ask their numbers because they may be careful to present that. So it has to be recorded. The feedback forms for your topics has to be recorded according to NNC also. So please, all of you, when you are designing a lesson plan, also design your feedback. And how to design a feedback? How the topic could have been better? What is good about the topic? What would not have been done in this topic? Like this presentation like that. So the students will come up their open answers, not closed answers. Like yes or no, not questions like that. There should be some open question. The student should come up what the things they are facing. So give a big round of applause for the students. This is second group. So second group is blue group. So
my group is blue group.
So you can use it. So Dr. Nagar sir will tell us.
Phase 3 of 2 students, 5-year MBBS students, topic is acute pancreatitis. Warm-up session 2 minutes. What is the tiger of the abdomen? First question. Tiger of the abdomen? Pancreas. Okay, warm-up session.
So it is very.
Tell me some brands. Only boys tell me some brands. Maybe girls also tell me some brands. Tell me some brands of all. Okay, warm over. Just 2 minutes. Next. Okay. Very short period. Self introduction. 5 minutes. A story. One of my senior taking all the Ronnie is suffering with gastric pain repeatedly and going to the radiology department. Ultrasound diagnosis of pancreatitis. Some story set introduction. Specific objects at the end of the session, student able to know. Describe the etiology of the acute pancreatitis 5 minutes. Describe the clinical features of acute pancreatitis 5 minutes. Describe the management, investigations and treatment of acute pancreatitis 10 minutes and 10 minutes. Domain cognitives knows how. Resource PPTs, videos, assessment, formative assessment with role play 5 minutes. Comments, Randy, Madam tell me roses and already rewards. Summary 2 minutes. They completed.
So we can put a feedback.
45 minutes lecture, 15 minutes assessment.
We can design a feedback also.
Feedback.
So thank you, very nice presentation. And sir is known for his creativity and stories. That's all known to us. So much energy. Okay, nice. Next coming to the third group, which one? So green, evergreen. Okay, green.
The competencies 5.5 aims to better physiology and clinical evaluation of alkaline liver disease. At the end of session, phase 4 students should be able to enlighten about the pathophysiology of alkaline liver disease and evaluate clinical signs and symptoms of alkaline liver disease and able to diagnose and case of alkaline liver disease. Introduction about 5 minutes. Method is B method and aids of PPT. Pathophysiology of about 10 minutes. Clinical signs and symptoms 10 minutes with the aids of audiovisual aids. Diagnosis of 10 minutes with the PPT and audiovisual aids. Evaluation of the session for 5 minutes. Asking MCQs or conducting quizzes. And feedback of 5 minutes. By giving feedback first.
Providing conference and
So thank you so much, madam. You have presented very nice. So about the topic and the Excel notes and also the allotment and the time, how you are going to do. Suppose if suddenly you come and need to attend an emergency case and Vijay or somebody else will need to take the class, then will go and give the lesson plan to math to tell about this. So it will become easy. So lesson plan is ready. That's how we get some interaction among our colleagues also. Colleagues will always be our friends, not any rivals. So don't be jealous like that. I only want to tell like this. So it should be always a friendly, competitive manner interaction. Okay, very nice. Thank you. Next, which is the fourth one? Yes. Fourth one is P. P monkey. P monkey, sir. Sorry, sir. So I can put something in. So yours. That's me.
Madam, competency is SU 28.8. So topic is carcinoma stomach. And specific learning objective at the end of the session, phase 3 part 2 students should be able to describe the etiology of carcinoma stomach and describe the pathogenesis and clinical features of carcinoma. Time allotted is 5 minutes for explaining the lesson topic and objectives by visual exposition through PowerPoint slides. 10 minutes for checking the knowledge of existing knowledge of students through question and answer session. This is 10 minutes. 30 minutes for explanation of the subject proper, that is etiology and pathogenesis by PPT slides and clinical features by PPT slides. Then 5 minutes for recapitulation. That is also through PPT slides, one line sentences in the form of PPT slides. Then 5 minutes evaluation of what has been taught through MCQs in this session, and 5 minutes take home message and feedback. Slide.
So you can put this take home message and in the recap in the form of summary. So I put the feedback. So very well, covering all the topics. That means the benefits will be repetitive things. Everybody writing all the things. Okay.
My topic is competency, fitness, requirement for salary. It is lecture and visualize and PPT.
Blue group. Kindly I need your attention, please.
Participants, basically, students. Specific learning objectives of my topic is after the completion of this class, students should be able to aware of this mechanism of action, classification, indications and contraindications in clinical setting, and side effects of animal glyphosate. And time I have planned for this is total 1 hour. It is 45 minutes for lectures and 15 minutes for speaker assessment. And introduction I have taken for 10 minutes. Mechanism of action, types, doses, side effects, indications for all these 15 minutes. And 10 minutes for assessment, 10 minutes for speaker.
So you have covered all the things and they have also allotted the time frame and you have included all the things. So orange group. So first group is red group, second group is blue group, third group is green, fourth is pink, and fifth is orange. You can add any adjective or any noun forms to it. Okay, it's up to you. So this has to be decided. Thank you. Now I hand over the mic to Dr. Ravi Kumar, sir, coordinator. Come to sir. Thank you. Hope this session is useful for you. What's the feedback? You write. Very useful or not? Yeah, I'm going to announce prize for you. So for these groups, I'll give you at the end of this BC. Okay?
The next session is by Dr. Ramadevi, Assistant Professor, Pediatrics. So please make sure you have sent the attendance sheet. You fill the feedback forms before going. Okay.
What's your opinion and what have you learned in the COVID training? Is it necessary or not? Necessary. In what way? Because of the changing curriculum to meet the needs of undergraduates. We covered 15 things because we were not expertise in teaching, but we were in medical expertise. We are in medical expertise. Okay. What do you think? Who has to work hard? Students is up to them. But from our side, from our side, from our side, we are working. We have to work a lot and we have to prepare. So after preparation of so much of already we have taught that yesterday. Without preparation, we are not going to take a session because it will be of no use and there will be no improvement. Then after so much of hard work by us, then what are we expecting from the students? And why do we want to teach them and why do we want to include them? As a part of our job, then first of all we have to remember that they are our doctors and we are their patients. So when I am on the operation table for some day, I want a competent surgeon to be operating on. So for that sake, it is mandatory that we should teach them until and they are going to learn everything which they are being taught. So assessment is very much important. So we have graduate assessment from students. So assessment drives learning. So assessment is based on the clinical skills and so assess the skills effectively based on the teaching learning objectives are. Assess skills at the workplace, use a skill lab to assess competency in the skills and design a skill assessment station. So these are the skills yesterday we have learned. So knowledge is tested in theory examinations and in clinical and practical examinations. Various methods may be at workplace and also in the skill lab. So these are the things. A wise combination of these tools are mandatory for a holistic outcome. So assessment should be multiple people and multiple ways of assessment will increase the validity of the and reliability of the assessments. So based on the skills we are going to assess them. See, intellectual or cognitive skills, yesterday what you have learned, psychomotor skills, communication skills and team skills. This is the same repetition. So these are the domains, these are the levels of competencies where we have to assess them. So in knows and knows how, knows how, okay, then shows how for a 5-year student in most of the times, and test is not for the UG students. Okay, for test is workplace assessment where it will be during the interns we need the test competency. So these are the things which in the factual ignores multiple choice questions, essay types, oral tests, both the theory and practicals. Knows how here are multiple choice questions, essay type, oral test, and it shows us the ASCII. Okay. And assessment of performance observation in real setting. This is the assessment. So this is recording the index where we can assess them. So they get the what is that they get in terms of the completion? Logbook. They get the logbook, they get inside. What happened, everything are knowing and we also document. So we will be needing this is ASCII and this is the ASCII practical examination and clinical examination. So recently we have completed one set of UG students, 5 people. So share your experiences about ASCII in recent examinations in your department. So group 1. So which department you are working? Medical department. How you have conducted ASCII? Were you a part of ASCII? Your examination. So next, any medicine department people who were a part of ASCII in the previous examination. Pediatric department. Okay. So you share your experiences. What you have done? How much preparation you have done for that? What was your idea? Before attending this class, you have conducted the ASCII.
I would have set up 5 stations now. One station is for X-rays, physical examination, nutrition area, authors. Preparation for the ASCII is actually a lot actually when compared to the previous Viva voice. Actually, have to prepare the questionnaire, have to set up the tables, have to make the standard checklists and keep that so that there will be equality among the students. So preparation from other teacher side is, I think, is double when compared to the traditional Viva voice. As far as experience is concerned, the students felt happy actually when compared to the traditional Viva voice. They felt a little bit easy. They felt there is some transparency going on in the records, at least by the evaluation side. And I think it was successful, first time successful on making an ASCII for the students.
Any other department? Group 1 who wants to share? Group 2 moving on to group 2. Surgery department. What were your experiences with ASCII? Okay.
In surgery department, 5 stations in one history taking, one regular patient, clinical examination, 1 station, 3 case scenarios. It is very easy to pass the
Is
students.
it the final practical examination?
Final practical.
Okay. So what was the time you required? How many students were there on the day?
Total 25 members.
25 students, and what was the time taken for ASCII?
Just 5 minutes.
Each
Each
station 5 minutes, or completion of 25 students. One and a half hour. Okay. So 5 stations. Only surgery, not all.
Only surgery.
Okay. Then, how did you get the material to be tested there in the stations? What do you keep in stations?
Patients are there.
So you need a patient. You need a patient.
Examination of the patient is there.
You need a patient.
3 case scenarios.
So why don't you keep one patient? So 25 people will be examining over the same patient.
Same patient.
Is it okay with the patient? Okay, then. Any other department? Group 3.
Preparation is somewhat time taking when compared to traditional.
Somewhat means how much time will you really take? Okay, only half day. Only to get the ASCII back.
Preparation at least 10 days.
Okay, it took at least 10 days.
At least 10 days.
As it was for the first time, when I in my department, I took 15 days. I took at least 15 days to cover all that time. Okay, because it was the first time. And we don't really have it asking right. So what are the things we kept in asking? Don't have it. So we have to prepare it, each and everything. And that is banned. That if we are given 5 stations, for each station at least 7 or 8 days. Because that will be going on, physical examination will be going on for 7 days. So 7 days we have to prepare. We cannot keep the same thing. We have to arrange it. Okay, we are not given any options.
Five, six.
5 6. Right, 5 6. Want to repeat it after 5 days? You want to?
Just a student,
We won't tell outside to that which is our there, how it will learn. And there will not be transparency. 60% will come and ask you. Please share your experiences. Any other department offer?
There will be uniformity in the examination.
So, maintain uniformity. What was your work in that? See, now
There will be standard set of questions
so
for
we have
each
no
of.
option other than asking. We have to other than asking. How we have done before we did. How can we improve?
There will be standard set of questions for each asking. So the questions will vary with student to student. So there will be uniformity for every student. That is one point. Which in compared to traditional examination. And one point is it is more time consuming.
Time consuming. Only time. Your problem is with only time. And waiting regarding Pratap because okay. Any other department from Mumbai?
Easy way to pass the students.
From student side, it is easy way to pass the student. Okay. How? Then we are not arranging it properly. How will students come to know about the questions which you have? I think you can. So you have to maintain confidentiality. అంత కష్టపడి చెప్పిన తర్వాత నువ్వు ఎట్లా పాస్ అవుతావో చూస్తాను అని అనుకోకపోయినా కనీసం డిఫికల్ట్ లెవెల్ అనేది చూపించాలి. డిఫికల్ట్ లెవెల్ చూపిస్తేనే వాళ్ళు చదువుతారు. I'm not able to do that. You are not able to.
Both are at the same place, then the answer is going down. For example, we have said it's difficult to organize the association because we don't have proper spacing. Like the ward, individual examination will be doing the half days and 5 days. We have to do some other ward and some other place to make up the association. Students will move from there to here. It is easy to answer the questions.
No, it depends on us to see that students go to here and there. We have to create it as a program.
From the examination point is to ask this.
For that, what we have done in writing department. When they please share your experiences in writing department.
So like really like modified so yes we are doing yes manuals and asking the
What Pratap told is that if students were moving in and around, we do not control them. So there is no option that they cannot know the questions. What they have done.
we have let the station separate for we have divided total 50 students into 3 groups and we have given separate stations for each group and separate cubicles for each station so that no one can contact to others.
See, regarding we have how we used to be in guiding department. We had a FNC where there are curtains for each station. So there that will be a stations. Actually, our examination will be conducted in that area. So we have there 36 tables where we divided it into 10 side stations and 10 beds. So 30 beds. We took 30. So 6 were empty. So in that 30, 5 on each side, MNC, this side part and that side part. 5 stations on one side and 5 stations on other side. So 10 students will be going to ASCII. So 10 students will be going to OPS long case and 10 students will be going to Granite case. So they will be rotating and there will not be any chance for them. So, yeah, that is what we have to prepare it. So we have not first we have yesterday, first we have also we have to prepare simulators. So if you not buy them, we have to prepare by ourselves. Like say for example, for laparoscopic simulators, if you want to have it without any expenditure, then we can take a water melon. So these are the ideas created by us itself. So we take a water melon, remove the pulp inside, then we create holes. So then from there we pass something maybe like a safety, which we can practice movement of the probes, instruments for the laparoscopy. See for example, if you want to simulate a DNC, then we can take a vagaya where we can create, we can get the real feeling of breathing and also we can put the seeds inside for that. Regarding the products of consumption. So we have to create and we have to become more creative than previous itself. So we have to extend, we have to spend time on becoming more creative. Not only the students have to follow the recruit, we also have to go to them to meet their demands. So that is the necessity makes it invention. Okay. For necessary, as it is necessary, we have to go into the. So we have divided that, and somewhere we have for the next task, next exam, we have to prepare. Whoever is there. Exam register, UP register, you have to prepare it. Group 4. Group 4. Group 4. Anyone to share? Anything? Group 4. Interested to share regarding asking? Group 5.
It was part of the surgery kind of practical examination. I would like to share my experience. First thing is that pros, quite happy that the standard of the practical examination increased. At that time we were in our final years, we were hearing of seniors about lab exam, clearance for inland. So different chambers should be there, different patients should be there. The student should move from one chamber to another. So this was similar to that. I'm happy that the standard has increased. And our patient was a CA breast, as you said yesterday, standardized patient. So she was telling the student where to stand, what are the mistakes they are committing in the examination. What happened was, students didn't have proper prior knowledge about the OSCE method, what they should do, what is the theory. So they were somewhere examining and somewhere telling the diagnosis. This is only just observation, what they should do, how to examine. So we should think of stressing more about it. The cons is that I thought it is a very time-consuming and laborious method. The students should move from all the 6 chambers to all the 6. It is time-consuming and you have to plan well before the exam.
Anything to share? So we continue. So these are the ASCII experiences and we have to equate. The first is completed. So when I went to examiner from Visually Medical College, there are some regarding ASCII. We have multiple examiners, internals and externals. They get 4 charts. We are the examiners and they go to ask. So first student will not be making, he will also be knowing. First student whoever comes to that will not be able to know what is the chart kept over there. Then the second student, third student, the fifth student will be knowing and in that division the one person also will answer it. So that is not the right way of giving the answer. No student who enters into the station and we should not know. Only the student which there will come to know. And has completed the ASCII will come to know. That's all. So objective, examiners use a checklist for evaluating the trainees. Structured because the same problem and perform the same task in the same time frame. So every student will feel the same difficulty. Generally we learn from our seniors or we learn from the difficulties of others. Or if you are going to do a work, if you want to go to a place who has already visited, take the views from them and take them home. But this is not the thing. So in the clinical, the tasks are representative of those faced in the real critical situations. ASCII is a form of performance-based testing to measure the candidate's clinical competence. So, what are the clinical competences? Mostly in the knows how and shows. So, during ASCII, candidate observed and evaluated as they go through a series of stations. A modern type of examination to assess the clinical skill performance and competence in skills such as communication, clinical examination, medical and surgical procedures like X-ray and simple suturing, physiology suturing, and interpretation of the results. So, lab reports, biopsy reports, and all this. See, in GMER regulations, we are provided with what are the stations we get. See, for example, in Gandhi, we are given 10 stations where they include biopsy, composite, clinical scenarios, HPE reports. So, in that, we have to plan. That is the blueprint. So, blueprint of ASCII. Like this, will be having, they will be given in the book. We have to take a frame a blueprint where in which system we are going to do, what are the symptoms we have history taking, what we have to ask in that. Examination part, what we ask them to do, procedure part. So, need not be in the same system. So, for 7 days, for example, we have 170 students, we will be planning for 7 days. So, we have to see that they don't repeat. If they repeat also, same question should not repeat. This is regarding guiding. Okay. Counseling, HPE reports, radiology, in this will be giving HSGs, IUCD, missing IUCD, and ultrasound reports where the early trimester, alpha scan, and scan reports also will be kept. In the lab report forms, scan report will be kept and they will be asked to read the report and write the revision. And what are they going to do with the situation? If they have coming any anomaly, so how are they going to manage it? So if it is in second trimester abortion, so how are they going to manage? Do they want to terminate it or do they want to continue the pregnancy? And what are the precautions they should take in the future pregnancy not to repeat the anomaly? So that is an example. That's it. So in there is more HPE treated and you may ask the set of questions in that. And we have kept a repository where we are asking the questions and identifying the spotter. So features of research stations will be very short. Remember that is for a short time. So many stations will be there and highly focused on what we are going to test. So what is the thing which we want to test in this? See, for example, if it is a long case discussion, then we'll be coming to know what is the total knowledge about that case scenario or about the patient. That will be a whole thing. But here will be framing the things. So we'll be cut short the things and it is focusing on only one competence. Candidates are given very specific instructions. We have to give them. A preset structured mark scheme is used. That is checklist. We have a checklist. If he performs this, what is the mark to be given? So they should be framed in such a way that only if he treats the patient, so for example, if it is a counseling center, if he treats the patient and says thank you, he should not pass without doing what we should be done there. So the weightage of the mark should be given in such a way that just he has to read it. If he doesn't read also, he should not read. But just by reading, he should not pass. So the weightage of the mark should be structured in such a way. If he without examining, he has to see the BP there. Without seeing the BP or without telling you that, he should not complete the exam. Preset structured mark scheme is used. Reduce examiner and input and discussion. So it will not be on the bias that only examiner should. However, we done during the clinical examination during our time. So while writing exams, the best examiner will move on. Whoever students are standing on the left side, they are waiting. So without coming to the though they ask us the questions, that is case discussion will be there. But what was the cause of failure? They have to the left side. So that was on the examination time. Reduce examination input and discussion. So that will be on the examiner's choice. What candidates get to rather than what they do. Application of knowledge rather than recall of knowledge. So by seeing the HPE report, they should come to know that this should be the diagnosis or this might be the differential diagnosis. Then come to the treatment. Measure the clinical skills if you have a skill procedure and match assessment to intended constructs. So based on what steps was done on that assessment will be there. Promote structured structured interaction between the student and examiner. Make structured marking scheme possible. Present all the candidates in the same test. So promote objectivity. On the way, if 25 students are attending the exam, they should have the same test. Interpersonal and communication skills, history rating skills, physical examination of specific body systems, clinical decision making, all these are the including the differential diagnosis. This will be tested there. Clinical problem solving skills, interpretation of clinical findings and investigations, management of clinical situation, including treatment, management, patient education, health promotion, active safety. So we can use counseling centers for postnatal advice or contraception. Ask the patient to have a contraception or to undergo sterilization. All this can be included. So the first step is to determine what should be assessed in each station. The knowledge 20%. These include history taking and recall the definitions, clinical pictures. So this should be in the 5 stations, only 20% of weightage should be there. So interpret and differentiate similar diseases, summarize the treatments, strategies. All this can be checked in knowledge part. And in skills part, this is for example of an wellness assessment, and we can use simple procedures to only the procedures as we have to. What are the skills to be learned by the UG that only has to be changed. Performance, how he has to have the communication skills, whether he introduces himself or not. What is his behavior, what is his attitude also have to be checked. Products, this comes under the clinical disorders that presently or something which can prepare and ask them what is it the contraceptives also. But as they will be tested in Viva, so need not be repeated here. So 5 stations, 5 minutes per station, faculty evaluated student, student instruction sheet which you have to keep there, evaluated mark sheet, evaluated progress note and feedback. We have to take a feedback. How the student has done while writing the exam. Were they too long? Were they very difficult? Were they not understand? And they do not understand what should be done in that station. There were no clear instructions. All they should be taken. So before asking, we have to plan and implementation and correction of the asking and evaluation. So have sets of clear objectives. Identify the practical aspects which we are going to test. Select the task, then set up, break into subtasks. There is this task, that is competency building. That should be sub-competency should be taken and assign scores. So you may prepare a checklist, again you have to score per one. Set up stations, then conduct after orienting the students and examiners. So we have to have a trial how does what instructions to the students and instructions to the examiners, instructions to the person who is conducting the asking should be clear. Make notes of the process and review, analyze the results and use the same for student and assessment. See, we can use our postgraduates to have a trial run. Not that what has kept on the first day of trial run should be repeated on the same day. Because we can't leave our teachings also. They go on there. They are the more source. So identification of competencies to be assessed, drawn from the curriculum, development of case scenarios based on the identified competencies, and we have to identify the modify development of evaluating tools. That is, we can take a checklist designed by ourselves, or it is there in the assessment module in our books. Then otherwise rating scales, global rating scales should be taken. For example, anastomosis of bowel. This is one rating. If we are keeping this, then we have to have a global rating scale from the system. And planning for resource. Who should be there to tell the student? If anything is required, the student should approach them. And what the venue should be set up for that we needed manpower. So plan structure, there should be venue, manpower, money, material, time. Process conduction, running a survey, and assessment should go on. That assessment should be valid assessment, variable assessment, student satisfaction should be there, examiner satisfaction. Okay. So if students are not satisfied, they are not allowed to talk, but we have to be ready. See here we have to see that there should be 2 doors for the room. That was the only limitation when we had arranged the masking. There were no two doors, only one door was there. So if only one door was there, we needed more manpower to see that they don't mingle with each other. So these are the lab examinations. Resources, all these answer requests well, all these should be available. Examination board, this manpower should be available for us. So preparing asking question format, we should have an asking bank. So there should be prepared in multiple letters. So in the requirement of the company, English is better because if you think that the question, you have prepared the question, that question should be seen by some other person. Are they equal, that is a colleague, so that he will come to know that what he is understanding. So what intention you have set the paper, is it the same thing which is being carried on? So final selection should be there and arranging the materials and resources, preparing the stations, station names, signboards should be clearly written. Station 1, what type of station is this? Then station 2, then station 3, and there should be signboards that is after the station where you have to go. Checklist preparation and evaluation forms, simulator administration, training simulated patients, when to train, preparing knowledge. If you need something to be prepared, if they are not available, then you have to prepare it by other person. Question paper, checklist, evaluation forms, attendance sheet. See that everyone has it. Day before exam, you have to see all this. We have we set the station, signboards, communication, and delivery with all the team members who are going to help you in arranging the stations. Then debriefing to the students, ensure entire planning days and the pilot run. So we have to see that on the day of exam, what we are going to do should be done on the day before exam. To see that if any blocking are there. On the day of exam, ensuring stations again, confidentiality, training simulated patients. So if you are using standardized patients, then you should give the script to them so that they should have learning. And see that they turn up on the day of exam. Debriefing to the team, what should be done, we have to have a discussion. Debriefing to the students by the marshal. Managing student flow, that there should not be any, they should continuously go on, there should not be any interruption. No student should come back. Attendance, debriefing to the students, ensuring confidentiality, manage student flow and initiation. After completion of off exam, I told the student to go to Gynec exam. She went to Gynec ward. We were searching for the student. Where is she? So that is, they should not escape. In spite of having so much of manpower around there, we could not trace out where did she go. I didn't understand whether she has not written the exam properly or she was afraid of the exam. Okay, she go because we wasted a lot of time in searching her. So she directly went to the Gynec ward. I went to go to the opposite ward to write the Gynec exam. She went to Gynec ward. So like that, we should not be disturbed by the interferences. Feedback to the students and from students. Feedback to the students is any evaluation. Feedback to the team and from people. So you see, only by feedback we will be learning so much. So only by feedback we will knowing what is the wrong we are doing, or we can develop the combinations, or we harsh with the teamwork. Lack of feasibility due to contact constraints, and we have to do a lot of work. Then there will be shortage of training for the use of masking, shortage of observers and examiners, lack of interest to have this much of work, lack of enforced guidance for practical examiners for the universities. As you said, there is no venue, so there should be something to be done for them. More valid than the traditional approach to clinical examination. So, for that sake, they have introduced this. Examination we decide in advance what is to be tested and then design the examination test is competencies. Okay. So we can before we can determine what should be tested. Examiners cannot better control on the content and complexity. So what we were done in last case discussion, we have made chips and whatever case comes to us, we go, or what are the cases if you are dealing with the real patients, what are the cases available, we will be doing that. Otherwise, just before exams, we will be going on admitting the patients, and it will be very difficult to find them for so many days. When we use with large number of students, reproducible, provides unique programmatic evaluation, less complexity, and valid examination. It can be used for summative and formative assessment also. So what are the disadvantages? Students' knowledge and skills are tested in compartments, say as not in whole, like long-based discussions and all. Demanding for both examiners and patient. The examiners are required to pay close attention to the students, repeating the same task on number of occasions. So we have to be there very patient. The time involved in setting up the examination is greater than for the traditional examination. So this, see, actually 5 stations, so 5 students only can go at a time for 25 students. 5 students in 5 minutes for each student, so totally 25 minutes. And to arrange again all within 5 minutes, so totally 30 minutes. So if 30 minutes for 5 students or 25 students or 5 sets, we require so much of time. For that, what we have done, our exam was announced on 30 days. And half an hour for taking the things what I have written. So in that half an hour itself, we have completed this only by, how 30 students, 30 minutes longest, 30 minutes running longest, 30 minutes asking. So like that we could manage it. Otherwise, if we have a asking rule and that, then we sending 5 students at a time. So for 5 setups we have to do. That too after writing option long option writing days, then it requires a lot of time. So if the students posted examine on Monday or tomorrow, then it will take a lot of time. So we have the same set of patients, but 10 students we have writing. So this side and that side, at a time we present 10 students. And if 2 rooms were there, 5 stations on this side and 5 stations on that side, both stations were the same thing, but we had 2 sets of each exam, each station. Maintaining uniform difficulty level is not always possible. That is a practical problem. Stations are of different stations, like history taking examination stations, skill stations. Real patients are the simulated patients. As the volunteers can be also utilized while when testing the process. We cannot include, we can use nurses and all, but we cannot include PGs or interns. Because that would be they will be taking the answers. So these are the tools where we can. Here we are providing the only, we are planning only for 5 stations, but actually there will be 15 stations and all. So after 5 stations, we need a rest station. We cannot go on continuously completing the 15 stations. So this should be signboard should be there. All this how we are written there. This is the examination process. Observer who will be standing there should not tell anything. Just observer. Okay. So we can use the instance and PGs because there will be a checklist. So we should see that he doesn't talk, he or she doesn't talk. And there will be a checklist, and he cannot use his personal experience. Just by seeing the checklist, he has to. If he has done that, if he has to partially done, fully done, completely done, and if he has not done, zero. Common practical problems, examiners not turning up, standardized patients not turning up, and patients not turning up, or days that stands, incorrect equipment, and patients taken, candidates taken, all these are the practical problems. Number of stations based on time for assessment, 10 minutes per station is more limited, but we use only 5 minutes as per the emergency time. And we have standardized patients. We can really healthy faculty as the standardized patients. We are not provided with standardized patients. Even at individualized way of scoring, we use reliability and assessing only one component at a time. So this is the limits-based validity. So we can combine with, we have long cases, short cases, and asking, and we have Viva. So this is multiple level of examination and multiple examiners will be doing that. Next coming to workplace-based assessment. This is that was the asking, and workplace-based assessment is next level of Miller's pyramid. So high face variability because we will entirely see the knowledge of the patient. narrate the student. Content and context is specific. So what case comes to that will be we want to that learner centered and feedback. We have to take feedback. So these are the common methods of any critical evaluation exercise, direct observation of procedure as case-based discussion. So based on concept, they will be asked to put the grips or to examine the patient and what is he doing. See, rather than asking for what history you have taken, if we see how is he taking the history, it will be more reliable than what history has been taken is being produced. So 50 minutes and this is the clinical evaluation exercise developed by American Board of Health Medicine, where they will be having a 15 minutes snapshot of doctor patient interaction. As I said, they see what he is doing and training will also be there, will be following and what is doing will be assessed. Estimated time 15 minutes. So this is a form where they will be writing the what he has performed, what the student has performed. History taking physical examination. So in history taking, what are the they will be divided 20 minutes. They will be seen they have a checklist in that form. So physical examination, communication skills, clinical judgment, professional that is clinical judgment is differential diagnosis and coming to diagnosis. Professionalism, how he has behavior and attitude. Organization efficacy, how if patient has any problems and any difficulty address language problem, how he is able to manage the problem. So we have direct observation. So the student will be doing and he will be observing what he is doing. He is not intervening between. So structured checklist and global rating will be there. Anything we can prepare the checklist or we can make a global rating. But whatever we are taking to assessment should be informed to them. Feedback form. In how many number of processes, but formative assessment. Maybe when they are in individual postings, how they have done the procedures and how many times they have done it to get the other preciseness. So knowledge about the procedure, informed consent, pre-procedure preparation, analgesia, technical ability, post-procedure management, counseling, communication. What they are going to do, have to be informed, how will the procedure go on, we have to encourage them to ask doubts, to clear their doubts, we have to take the time, and then we have to tell, after the procedure also, okay, the procedure went on well, and whatever we have to communicate with the patient should be done. All this will be evaluated, and this form contains all those things. And case-based discussions. So how we have taken the instances and whole age-old process. For that also will be given the format. If you have to become more precise. Mini-meal assessment tool. This 8 assessments is not for the faculty or for if you are going if you are posted as a resident and all, will be having mini-meal assessment. It is in how we are behaving in our colleagues. For example, PGs also. They will have to prepare a portfolio for the PGs where they will be taking that portfolio to work in the places wherever they require. Then that after resident form and all. So data assessors will be nominated and they will be that may be needs supervisors, including nurses, health professionals, everyone and questionnaire will be there, how they were behaving, how they were talking, were they harsh, were they involved, were they speaking, all those things will be there. And argument about the strengths and weakness of the training and plan for improvement. So we have to tell that, and this is also a faculty development program. 360-degree evaluation. This also from the PGs, this will be mainly used for evaluating the PGs. So around, we will be asking the colleagues, staffers, and the juniors, and the superior faculty, and the grade juniors, and security people, whoever are there, patient they will be taking the impact, all the species will be impact will be taken, and their performance will be assessed. Includes narrative comments as well as statistical data. They will be seeing the procedures they have done also. Anything, any gross mistakes, anything they are very well, all this will be taken. So long-term students will record the patients, the procedures they have done, either into or e-log. E-log also can be done. Police categorization, process and intern, police categorization. We have a checklist. If he has done it properly, either a teaching or a senior resident or an immediate faculty. Anyone can see that and see the checklist and upload it in the student nominee, they will have every student will have their number and that you can upload it there. What he has done the procedure. So the document also should contain that checklist. It documents the rating of patient care and learning experience of the students. Document is very useful in focusing the students on important objectives that must be fulfilled within a specified period. For example, in paper means how many deliveries he has conducted or how many emergency cases he has dealt with, any blood transfusion reactions or any reasons towards the patient, anything problem created by the student, all this can be assessed. The attendance also will include in the logbook. Portfolio collection of one's professional and personal goals, achievements, and method of achieving these goals. So this is trainees, development, and technical capacity. All this for release and for any residents, senior residents. So it should include ratio preferences, awards and achievements, work experience, how many years they have worked, and if any rating experience, leadership experience, whether they had any leadership qualities or not, extracurricular activities, special skills, examples of work, or any special work they have done, or any work which is being done, which has been done very appropriate way, or in a very skillful way, follow treatment. All this will be included in the portfolio, which can carry on to future. So assessment of clinical skills can be done in various ways. Assessment should be tailored with the domain to be tested. Level of the domain is knowledge or this attitude behavior level. And level of student to be tested means how he knows, shows how he tests. Resources available based on our available resources and whether formative or summative assessment. Level of preparedness to be tested. Objective methods equal to traditional methods. This is needed to remove the subject bias and grading bias. So let us move on to all the clinical branches students. All the clinical branches faculty members will go to the next station and the rest of people will remain. Clinical means medicine, surgery, gynae, community medicine. Please carry pens. Please carry pens. Clinical branches will go to us. Take each of the secret. I need an extra professor.
Good morning, all the participants. All the participants, please come to the hall. We Good morning, ma'am. I request observer Dr. Sujata ma'am to please come. Yes. I request Dr. Sujata please come. Please put that council and the person who should make the please come. We are giving certificates only for the photos and for your satisfaction. So these certificates will go to CMC again. We will call names. Please come.
K. Navatam Reddy sir. Dr. Pratap Devi. Dr. Vijay Kumar Madhusudan. Dr. Raju Dasari. Dr. David Chakravarti. Sheikh Muhammad Talib Rajan. Dr. Venela Mole. Dr. Sheikh Muhammad Talib Rajan. Dr. Chakravarti Ahmad. Dr. Pravina S. Dr. Frida Pujala. Dr. Ujjwala Kiran Reddy. Dr. Kadapa. Syahid. Dr. Abdul Ahmad.
I request Dr. K.B. Arun, Professor in Executive, please come.
Dr. K. Mahapan. Dr. B. Nagesh Kumar. Dr. Pushpalata. Dr. Pravia Lai. Dr. David Reddy.
Dr. Sayed Imam Sali, Dr. Awal Joseph, Dr. Zia Kumar, Dr. M. A. Ramareddy, Nagaraju, Dr. Awal Fatmawati, Dr. Nagila Jagdish Babu, Dr. B. Venkateswaru, Dr. B. Venkateswaru, Dr. Raju, certificates for facilitators, co-facilitators, Dr. K. V. Yadavan Reddy sir, Dr. C. Amir madam, Dr. B. Hamid madam, Dr. C. Venkata Kumar sir, Dr. A. Ramsagar Reddy sir, Dr. C. Ramanega madam, Dr. U. Srinivasa sir, Dr. Parveen Sheikh, Dr. Kiran Kumar Reddy sir, Dr. D. Ramadevi madam,
Now, we extend our observance that we are the reports of areas of community.
First of all, I would like to thank NMC and CMC Working Center for giving me this opportunity to come here as an observer. This is my third workshop where I am going as an observer. So I have seen two more centers. Your center was equally competent and performed much better than the others. Participants were all active. And yes, you have shown your enthusiasm. I've seen all the seniors also participating. So it is really encouraging for the youngsters. Hope you have learned a lot from this workshop, which you will be carrying over through your day-to-day activities, wherein we can strengthen, as one of our speakers was telling, we are not educating the students. We are going to educate the doctors to whom we are going to be patients tomorrow. So that one thing is what we all as medical teachers should emphasize on, that we have to produce quality doctors. And the way NMC is going and our medical education is moving on, we are only looking at the quantity of the doctors, but we are not looking into the quality of the doctors. I think we all as medical teachers have the global burden in us that we need to produce quality doctors to the society. Hope this change in curriculum and this faculty development programs which is being conducted all over by our NMC is going to serve the purpose. What you have learned from here, if you start using it every day, maybe in a lecture class, in a small group teaching, wherever possible, we can definitely shape the younger minds and our young doctors. They do because when we were students, like somebody of sir told, when I was a student, this much of opportunities were not there. I think we all have to agree with that. When we were students, we didn't have this much of opportunity. The things were done, but it was not named. There was no name for that particular age. Small group teachings were there, observations were there, mentoring was there, but then it was not named and it was the prescribed format was not there for them. But now all that is put in place and NMC is taking an effort to train everybody. So there are around 700 plus colleges and around 1 lakh 1,000 MBBS seats throughout the country. And we know we have so many aims and government colleges, each district coming up with a government college and all that. So still more the number is going to get added on. So we need to work on producing quality doctors. For that we have to be quality teachers. We've been trained to treat patients, but we've never been trained to teach students. So this workshop is emphasized on training you all to teach students. Hopefully you carry this message and incorporate small things which all your wonderful facilitators have taught you all through these 3 days. It was a nice experience here, experiencing extreme art over this place. It was a nice experience. I thank Madam and your coordinator sir and all your team for giving me this opportunity. Thank you.
basic course, medical education workshop in our college by medical education coordinated Dr. Ravi Kumar and team of resources. Workshop చేయడానికి కొంతమంది రిసోర్స్ పర్సన్స్ వాళ్ళ పర్సనల్ అర్జెంట్ వర్క్లో వాళ్ళు వెళ్ళాలనుకుంటున్నారు. కోఆర్డినేటర్ అన్ని విషయాల్లో కూడా ప్రతి దాంట్లో నాకు ఎక్కడ శ్రమ లేకుండా అన్ని ప్రతి రోజుకి ఒక 2 months 3 months నుంచి రిసోర్స్ పర్సన్స్కి ట్రైనింగ్ ఇచ్చినప్పటి నుంచి వాళ్ళకి చాలా బాగా వాళ్ళు చేసేది వర్క్ మీకు ముందు and all the other resource persons also. మిగతా వాళ్ళు మేము ఎందుకు చెప్పాలి వాళ్ళ పర్సనల్ ప్రాబ్లం అని కాకుండా వెంటనే వాళ్ళు మేము 2-3 క్లాసెస్ అందరూ వేరువేరుగా కంగ్రాచులేట్ ఆల్ రిసోర్స్ పర్సన్స్. తర్వాత మీకు కూడా కంగ్రాచులేషన్స్. అబ్జర్వర్ మేడం చాలా బాగా పార్టిసిపేట్ చేశారండి. నిర్మలమ్మ చాలా ఎక్కడో ఉండేవాళ్ళు వాళ్ళు చేత కూడా వర్క్ చేయించి అదే వర్క్ కూడా చేసి పెంచి కూడా తను చాలా బాగా చేశారు. సో మేము చిన్న డిపార్ట్మెంట్ ఇవ్వలేదు మనకి ఎక్కడ లేకుండా నేను ఒకవేళ ఎవరైనా మర్చిపోయినా కూడా అందరికీ వర్తిస్తాను. థ్యాంక్ యూ. లేదండి నేను అనుకుంటాను నేను వచ్చాక నేను ముందు రోజు వచ్చాను నాకు అది ఉండే ఉండి నేను తప్పకుండా పెట్టించాను ముందు రోజు చూస్తాను మీకు వీళ్ళకి నెక్స్ట్ నుంచి పెట్టించాను తప్పకుండా.
So clinical branches are total 26, 24. 5 stations are there. 5 stations. The right station is station 3 and over there. Consider right. Station 1, station 2, station 3, station 4, station 5. All of the 6 members from each department one should be there. So we will divide it as 6. So you have to go to the station. First you will go to station 1, second you will go to station 2, third to station 3, and fourth to and so on. So in station 1, all the prime members wherever door is, you have to see what is written over there. That is, if it is an observant station, one should, among the prime members, one should act as student, one should act as observer, one should act as candidate station if necessary. According to the requirement of the station, whatever is arranged there. So rest of the person will come after seeing all those things. So you will be given 5 to 10 minutes to see what is going on at the station so that you will understand how to set up an ASCII station. So after when the station is going to start, that is you can take a pilot run. See whether everything is arranged, anything is deficient, any document are there, whether the question is written correctly or not, instructions are given to whoever goes to the station or that you have to check there. Then after that, rest of the persons who are not required in the station can come out and you can join us. So then, second station, third station, if it is a different station, only one of the person is that is student will stay there. So the student, whoever has taken the role of student will do the ASCII. That is student 1, student 2, student 3, student 4. So you go to the second station whenever the real ASCII starts. So it will be given after each station is for 5 minutes and each station marks will be written over there. Whatever you have to do in that station will be clearly written there. So station after 4 minutes it will be given a short while. Then after 5 minutes, that is after 1 minute, that is totally after 5 minutes it will be given a long while. Then you have to move on to the second station. After completion of 5 stations, you have to give the feedback. Whoever is taken the role of student. So don't go there and see that I can't be the student, I can't be. It's a mock trial as well. After that, we'll assess how we have arranged the stations.
Decide by now who is the student. Decide who is the student, who is the observer, who is. Otherwise, it will be problem.
That is totally a leadership. can keep it at this better from in the okay.
Now coming to aspect. So what is aspect? Objective, structured, practical examination. The term ASPE derived from the originally from the ASCII in 1975, which was later extended to practical examination, modified by Carter and Lesser. The practical examination has several problems, especially in terms of outcome. So mainly outcome. So out of the various methods adapted in ASPE was largely tested on the basis of the success of the ASPE. So basically the ASPE is a method of practical examination and assessment tool, important assessment tool. And the subjects here we are using the subject and materials. Are used instead of patients. In ASPE they are using the patient. Here we are using the subject materials. So these are the objectives. What is ASPE? Learn how to plan or organize an ASPE. That is preparation and identify what are the advantages and disadvantages of ASPE. So the very important features of the ASPE. So the main important features. So the process and product are tested, giving importance to individual competencies. So the examination covers a broad range of practical skills and content. So mainly important practical testing, practical skills are much wider than a conventional examination. And also importantly, the scoring. The scoring is objective since standards and competence are present. So there is a difference between the examinee and examiner. The student is an examinee. So whereas the examiner is a internal or external examiner. So the adoption of ASPE. So mainly experiment performed and controlled in a controlled manner. No interaction with the examiner. So mainly there is no interaction with the examiner. So criteria. So what is the criteria of ASPE? The uniform for all the candidates. The main important is uniform for all candidates. And assessment of the all objectives. And also scoring. Square by checklist. So next coming to what are the various steps for preparing an ASPE exam. So there is a final second year or first year practical examination. So before conducting, how to cut. So the planning is important. And set up the station. So a set of clear objectives and identify the practical aspects. Next one is select the task. So most important task. Selection of the task also very important. Next, stations. So depending upon the task, so we will set up the 5 or 6 stations. And assign the scores. The score or weightage for each subtask. And break into subtasks. Next one is conducting or after orienting the first before the conducting of OSCE examination, there is the first orientation of the student and examiner. And make notes on the process and finally review. And analyze the results. Finally, analysis. And use the same for the student. So what is station? So station is nothing but it is a site which the student is assessed on practical ability. This is station. The total number of stations will vary as based on the number of skills. So there is behavior, attitude, or items to be tested. So depending upon the skills, you have to test. So during the exam, the student passed by a number of stations. So for starting with 1 to 5. So first station 1 to 5. And move to the next station. And bring up the value. So 1 minute, the time allocation also important. So 1 minute for one station, next jump to another station. So one first student, next second, third, fourth, fifth. That is bring up and also duration of the station. Station duration also important. So duration of the station has been fixed. So make sure that the task expected of the student can be accomplished within the time, stipulated time. So time ranging. So depending upon the theme, or 4 to 15 minutes. Average is 5 minutes. Station probably most frequently chosen. So the time depends on the competency, depending upon the competency to be assessed in the examination. Next, practice session. So brief the students. So give first briefing the student and evaluators. And what is the starting time? And clearly you can mention the starting time and ending time. And clear instruction given to each station. So now interaction with the examiner and distribute exam sheet to students. The number of students per station is 1. So move in direction, bring up bell. So formulating OSCE exercise 1. So how to formulate it? So based on what are the criteria for formulating an OSCE. First, consideration before conducting session. The first is objective. So, reading has to have an objective. And language should be clear language. And also standardized and steps to be involved. The number and content. Time required to answer. So, these are the first criteria. So, format OSCE exercise 2. So, assessment of theoretical concept. So you have to test the psychomotor skills or observation and interpretation. So format OSCE exercise. So supplementation of the question with graph, diagram. So diagram. Next animal or specimens. What are the specimens? Normal subjects, tables, charts or patients. Clinical charts can. So format OSCE exercise 4. So predominant checklist. So maybe what are the materials used required and instruction to teaching step. And key containing model answers, marks distribution of the mass answer, 5 marks answer. So we will marking of distribution. The steps to be involved. Next, find the checklist. So checklist is also very important. So steps. So this the properly doing steps step one by one and break into small steps. Outcome independent of previous steps and makes mass distribution and importance. So it is importance of each step. So validation by test runs, either PG or EG. Just open the sections. I will give example. The person task is they perform weighting test and report your grade. Mass distribution is 5 marks. So competency is demonstrate the ability to perform weighting test in a given urine sample and interpret the result. So this is competency. The sub-competency is perform correctly the steps of weighting in a given urine sample and interpret the results. So what are the materials used for testing the weighting?